An infection can now develop into a very bad infection. It means it's not only happening in the teeth, this bad infection, but it can also cause other, infections in the body, especially, in the lung area, or where exactly?
So there's a condition called Ludwig's angina.
Yeah.
All right. Mm-hmm. So Ludwig's angina is a severe infection that is mostly odontogenic, meaning it usually starts from the tooth. All right. So you have a cavity or gum infection, then the infection spreads down, because actually a cavity is a bacterial infection. It is actually a bacterial infection of the tooth, all right?
Yeah.
So if this bacteria is left unattended and it descends down to the nerves of the tooth and where we have the blood vessels, because a tooth has blood vessels, all right? So when it gets to the blood vessels are interconnected with the rest of the body. So the first place that it's going to go is to the roots of the tooth. All right? Where are the roots anchored? The roots are anchored inside the bone. That is the jawbone. So the infection spreads there and gets to the root, and it forms what we call a periapical pathology. All right? That is on the root. And when it forms that infection on the root, let's even call it pus. The pus accumulates in your jawbone.
Oh, wow.
That is when you get a swelling. I'm sure you've ever heard people saying, my tooth is swollen.
Yeah.
All right? That is actually pus, which is swollen around the root and the jawbone. Now, remember, like we said, the tooth, the blood vessels, they're all interlinked all the way back to the heart and all those things, right? So when that infection, again, is not sorted at that particular point, what will it do? It will start spreading extraorally, meaning that it goes to other places. The way the face and the neck region is made is that there are spaces that are not there, but they can be there. We call them potential spaces. All right. So potential meaning that should there be an infection, it will find its way down. And when it gets to the front of the neck, it now starts compressing your trachea. Okay, the trachea is the windpipe that we use for breathing. All right, it compresses there, and actually you now start having difficulty in breathing. You'd find that these patients are really struggling to breathe. Their nostrils are flared. Their tongue is out. We actually call it the hot potato syndrome.
Yeah.
You see the way if you bite a hot potato, the way you react.
Yes.
So you'd find that their tongue is out. They are trying to breathe through the mouth. There's a swelling that has come to the anterior of the neck. And this was evident, I'm sure, to our viewers, of the man that we unfortunately lost to a quack in Kawangware.
Yes.
If you watch that video, you'll see that there's a swelling that is underneath the jaw all the way to the front of the neck. So that is an infection that spread from the tooth down to the bones to the potential spaces, found its way to the anterior of the neck. And now that becomes a dental emergency, because if decompression is not done, surgical decompression is not done, and medication instituted, you can lose that patient. Actually, we normally say it can be fatal even within 24 hours, because it will affect your airway. And most of the time, especially when the patient is immunocompromised, either they have those immunosuppressive conditions or even pregnancy, what will happen is that infection can spread to the anterior of the neck. Anterior of the neck goes down to the chest, all right? So when it gets there, we call it necrotizing fasciitis, because it has gone all the way to the... So it is no longer now...
Doctor, today you're using big terms. Kwani, you don't want us to understand.
So that's why, we just said it goes to the front of the neck, then it descends to the chest. And now when it gets there, most likely you are going to get spread of the infection through blood. So meaning that it can go throughout the body, and that is what we call sepsis.
Right.
So sepsis is basically spread of an infection throughout the body. So we started with a cavity that is not attended.
Just
someone
tooth.
ignored a tooth.
Someone
got an infection of a tooth, ignored it, took painkillers, never got resolved, got a swelling, the swelling descended down. And if you are not careful, you can lose this patient. And unfortunately, again, our oral health seeking behavior, kuna watu watakuja amesema huyu amerogwa, they don't understand how a tooth can, and that's why we are here to create awareness.
Yeah.
You'd find that they present very early, very late, you know. Wameenda kwa daktari wa mitishamba, daktari kutoka Pemba, everywhere. So by the time they are coming to Dr. Muriuki, it is too late. Probably the infection is already a sepsis, and in that case, the patient has to be admitted. A lot of strong antibiotics given, surgical debridement in theatre to be done. So just from a small thing that could have been sorted very early on. And it is important that we are talking about pregnancy, because pregnancy sometimes can lead to this, you know, escalation of an otherwise a problem that the body would ordinarily be able to fight.
So are pregnant women more susceptible to toothache or tooth problems, Dr.?
Yes, they are. They are very susceptible because of, like we say, the behavioral changes, snacking, they like eating all sorts of things. Then again, the hormonal imbalance causes the pH of the mouth to change. And we also talked about some of the things that happen during pregnancy, including vomiting, can also lead to that. So they are very susceptible to this. They are very highly susceptible to gum disease. They are highly susceptible to what we call oral tumors. So there's a particular, we actually loosely call it pregnancy tumor, where you find the gums get really swollen, all right? They bleed a lot, all right? Where you brush and you find that you're bleeding a lot. All that is linked to, you know, this, the condition of pregnancy, where there's a lot of changes that are happening. So yes, to answer your question, they are very susceptible to some of these conditions, including now gum disease, acceleration of cavity. It doesn't mean that the cavities might form during pregnancy. They could have been there, but now they've worsened during pregnancy because of all those things that we've talked about.
Right. Now there's a video that I saw on